goal of this series is to provide all those whose lives have been affected by cancer with the tools and resources to live well beyond cancer. The team at Revital want to enable you to do the things that are important to you. Things like enjoying your holiday lunch, visiting with family, reflecting on your year, all those things that pretty much make you, you. The Revital team of therapists are trained to help you identify and achieve goals specific to you. It is my honor to introduce our presenter today. Jessika Wheeler, occupational therapist, certified lymphedema therapist, and Revital Cancer Rehabilitation Program Director for Minnesota. Jessika graduated with a master's degree from University of North Dakota in 2017 and has been interested in the role of rehabilitation in cancer care prior to this. She completed her thesis on expanding the role of occupational therapy in oncology, where she developed a holistic treatment guide and screening tool she later presented at the American Occupational Therapy Association's annual conference. Jessika is a cancer rehabilitation specialist and certified lymphedema therapist. After our presentation, we will do a live Q&A. Please add any questions you have in the Q&A message box on the screen. All your questions can only be viewed by the panel answering them. If we are not able to get to your question today, we will follow up with you via email this week. A reminder that this material is not intended to represent methods and/or procedures available for the medical conditions discussed, but is only intended to represent an approach, view, statement, or opinion of the presenter which may be helpful or of interest to patients, caregivers, or practitioners. Under no circumstances is the information provided to serve as medical advice. After our video today, we will do our live Q&A, and we will also let you know where you can find a cancer rehabilitation specialist in your area. Without further ado, we're going to enjoy this presentation of Jessika's, and I will see you after the video.
Welcome to the Living Well Beyond Cancer Survivor Series. Thanks for joining us today. Hi, everyone. My name is Jessika Wheeler, and I'm a Revital certified cancer rehabilitation occupational therapist and certified lymphedema therapist. Thank you for joining me today for this session on how to navigate the holidays. At the time we were hosting this, we will have just celebrated Thanksgiving a week and a half ago. The last night of Hanukkah was yesterday, and we are approaching the lineup of the solstice, Christmas, Boxing Day, and New Year's Day. So I want to wish everyone a happy everything. But this topic of navigating a holiday or event is really a year-round, timeless opportunity. So if you haven't already, grab a pen and some paper or open up a note on your phone and get ready to take some notes. I will share some ideas, but I really want them to be a jumping off point for you to find your own great ideas. Cancer is a journey, and we recognize not everyone's path is the same. Everyone starts their journey in a different place. Your age, your beliefs, your support system of family and friends, your general health or well-being, among other factors that contribute to how you are starting your journey. Also, your destination may be different. Where are you aiming to go? Your destination may be finishing treatment and putting cancer behind you. It may be living with a chronic condition, managing side effects to lead as normal and independent life as possible. Your destination is working towards your goals in care. Once diagnosed with cancer, your path may take you through a variety of different choices: surgery, chemotherapy, targeted therapy, radiation, all of which are customized by your cancer care team to meet your needs and get you to your destination. With each specialized treatment, side effects and intensity of side effects may vary as well. The tolerance to treatment will be impacted by your general well-being where you started your journey. Your team wants to help prepare, or our team wants to help you prepare and keep your motor running smoothly throughout your journey to your destination. Let's dive into our topic today of navigating the holidays. I'm sure so many of us can relate to the idea that while the holidays are so fun and full of joy, they can also be a source of stress, worry, and pressure. Cooking special foods, hosting large parties, buying gifts, etc. And that's why I want to take this opportunity to share some ideas about how to use our time and energy during these moments in a way that sets us up for smooth sailing so we can enjoy ourselves without feeling like we have to go hide or crawl into a cave to recover for weeks or a month after events. I want this presentation to help during the obvious upcoming December holidays, but these tools are good to remember for every holiday or event. Easter, Ramadan, Hanukkah, Navaratri, weddings, graduations, 4th of July, Kwanzaa, any time of high expectation and extra activities, remember the reason and intention for what you are doing and celebrating. And remember that it is okay to do what you can with what you have. So first, I want you to think about setting an intention for an upcoming holiday. Ponder, visualize, write down, or imagine how you want to feel during this event or season. Now, I want you to keep this in mind as your focus as we go through some strategies and ideas today. These next few slides are going to be things I build off of throughout the rest of our presentation. I want us all to remember that we have our regular, everyday routines and responsibilities, including work, family, the list goes on. So when we talk about preparing for holidays or special events, I encourage everyone to self-assess how much energy you have, what you have in your calendar, and what kind of plan you can make to take care of both yourself and your to-do list. Let's start with time management. This is one of the biggest stressors for people. So much to do and so little time to do it. Holidays and events always feel like they manage to sneak up on us. So whether it's on your phone, a paper calendar for everyone in your house to see, have one space where all your events and activities can be located. Seeing a timeline gives you a chance to plan tasks around each other so you don't wear yourself out. This also gives you the chance to start preparing for the event a few days or even weeks in advance as needed. Try to space out activities and to-do items so that they don't all have to get done in one day or pile up at the end of the week and cause a lot more stress. Also, quick tip, check out how to use alarms and timers on your phone to make sure you don't get sucked into the time warp and spend like 5 or more hours wrapping gifts or trying to perfect your pie crust when you have a family dinner to prepare for the next day. Having time to prepare a schedule gives you the chance to plan around treatments and set realistic expectations too. For example, hosting a big family meal 2 days after chemo might not be an ideal situation. Offer to reschedule events for when you usually start to feel better, or even before chemo might be a helpful modification. Having a delayed holiday until a few weeks after radiation is done, or even scheduling a celebration early before surgery are all possible opportunities to keep celebrations on the calendar. Energy conservation and energy management. All right, so there's so many things that we want to be doing during this holiday season. Decorating, cooking special food, traveling, all super fun things, but they take energy. Our daily lives can make us tired, and now we have to do more and be happy about it. To make sure that you have the energy to feel present and engage in events and activities this holiday season or other times of the year, try some energy conservation strategies. So energy conservation strategies adapt the way you carry out your activities and helps you assess and adapt the environment where you do the activities themselves. This way, you can do what you need to do and still have a chance to do what you want to do. So I introduced this topic with schedule management because they're so closely related. When thinking about how you will get all the holiday preparation done in time, remember the 4 Ps. Plan. Make a plan to space out preparations into stages. Shopping for 1 hour at a time or decorating for 30 minutes before taking a rest. Remember those timers I mentioned? Set some realistic goals and timelines accounting for your symptoms during active treatment too. Prioritize. Make sure you still get your day-to-day activities done and make a list of your absolute must-haves for a holiday to budget some time and energy for them to keep the holiday special and meaningful to you and your family. Pace yourself. Give yourself enough time to get something done and listen to your body. It's easier to keep fatigue managed by regular rest breaks than trying to pick up the pieces after you've used all your energy. Position. Even completing tasks while seated, remembering good posture for breathing mechanics can all reduce the energy it takes to complete a task. So, those are 2 really big topics. What does this look like? Socializing. So humans are innately social creatures. I want to make sure that even though you might be experiencing some symptoms and side effects, that you're all finding ways to still engage and interact with your family and friends in some way. But I want you to remember these things. Set boundaries. Tell people things that you are and aren't willing or able to do. Cooking, planning and organizing, traveling over 2 hours. If someone were to tell you their boundaries, that they couldn't wrap your birthday gift because it hurt their hands, how would you react? Probably you would say, oh, that's okay. You didn't even have to get me anything in the first place. If you're so willing to give grace, you can set boundaries to expect it of others too. Plan ahead. Make sure you allow for the preparation time you need and set some time to bounce back and assess your body signs after. It's a good sign to be pleasantly surprised and have extra time or energy after an event versus underestimating how much something would take out of you and then having to go do something else the next day. Keep it comfortable and remember your creature comforts. Bathrooms, when you are balancing constipation or diarrhea, can be crucial. Having a quiet place to escape to so you can take a break are essential. Find those things at various holiday parties you're going to. Introverts and extroverts, beware. Being around others can take a lot of energy. Busy social environments can overwhelm introverts. And extroverts can get wrapped up into celebration or hanging out with people just to crash after. Remember to check in with yourself to see what you need. When in doubt, plan smaller gatherings with just a few people in a controlled, familiar environment. Smaller events can be just as fabulous as giant family bashes. Cooking. So much of the holidays focuses around what's on the table. So I offer these solutions. For any of you that have tuned into the Food Network and heard about Sandra D's or Sandra Lee's semi-homemade cooking techniques, here she is. So, semi-homemade cooking, cut some corners. Make baked potatoes instead of mashed potatoes. Use some store-bought components or dishes. Remember that frozen pie crust, instant matzo ball soup, store-bought rotisserie chickens, stovetop stuffing, and grocery store catering exist. Use them if you need them, even for all or components of a meal. Now, if you're hosting, request a shared meal or potluck style approach. Have everyone else bring a dish, and you pick what is realistic and enjoyable for you to cook, and delegate everything else. I think we can all understand, too, that these are weird times. So embrace it. Have a weird meal. Everyone will be able to look back and laugh at that one 4th of July where you just bought KFC chicken instead of standing at the grill for hours. Buy a rotisserie chicken for Thanksgiving instead of cooking a turkey in the oven for hours and remembering to baste it. Use this as an opportunity to teach someone else how to cook the traditional family recipes that you know. Pass it on. You can sit down or call the shots and talk children, grandchildren, nieces, or nephews through the steps of a recipe to pass on your wisdom, tips, and tricks. Again, such a huge cornerstone of the holidays can be religious and spiritual traditions. I can't possibly be an expert on everything there is to know out there, but what I do know is that communities exist for a reason. Consult with your spiritual and cultural leaders. Faith leaders can offer an alternative to some of the practices that might impact your energy and symptoms, but are cornerstones to your faith that you don't necessarily want to give up. They might have great tips and tricks that others have shared with them that you can implement too. They could also offer something else you can do instead. As well, they could even offer you prayers, blessings, or well wishes, which is totally what this holiday season is about. Now, how often do people ask, how are you doing? For holiday gatherings, you might see some people that you haven't in a while that have heard about your cancer journey and will ask about how treatment is going, or share well-intentioned advice about someone else's experience with cancer, or something you could try to make you feel better. Most people don't know how to navigate these conversations on either side, but they just want to know what they can do to support you. So I want to take a moment here to give you a gentle reminder or permission or whatever you need that you don't have to tell everyone everything. Sometimes it might feel good to talk about it. Sometimes it might be too much. If you want to talk about it with someone who asked, but it feels like the wrong time, offer to call them or meet up at another time. Or if it's a person you don't want to go into too much detail with, it's okay to just give them a quick generic summary and guide the conversation in a different direction. Enter the elevator speech. So an elevator speech is a 1 minute or less response that you're supposed to be able to, quote, deliver within an elevator ride. It's a short summary where you can include as much or as little detail as you want. Write it out, practice it if you need to. But this still doesn't mean you have to walk them through your whole journey to date, your treatments and your side effects, unless you want to. If you want to talk to someone more, set up a time to connect or find a quiet spot where you can talk further. It's important to remember that your journey is your own, not anyone else's. Financial wellness is another thing to keep in mind this holiday season. I know this is a national presentation, so I pulled some national resources here, but I'm going to encourage you to get local too. So there are financial support options out there for a variety of life expenses: mortgage, gas, medical bills, food, even some assistance paying for holiday expenses like gifts. Check out the American Cancer Society or findhelp.org to hear about various options available nationally. Like I said, for a local flavor, ask your oncology team about getting connected to a social worker. Ask your vital cancer rehab specialist if they know of any local aid programs, or even ask a church or spiritual leader if your faith community was organizing any fundraisers that you could help out or that could help you out. Now, I would be doing myself as an occupational therapist and my fellow speech language and physical therapists a disservice if I didn't talk about exercise and activity. So these are some key things that I want you guys to remember, all right? Just because it's the holidays or just because we're going through cancer treatment doesn't mean that we want you to be inactive. Keeping time for exercise and activity is really important. Going back to energy management, appropriately dosed exercise can add to your energy reserves, reduce stress, improve your mood, and promote better sleep. Not to mention the weight management benefits that are crucial to navigating a holiday diet. So here are some general guidelines that you should review with a cancer rehabilitation specialist to figure out what this might look like for you. Essentially, again, I want you to avoid inactivity wherever possible. Try to exercise at least 10 minutes at a time and spreading that activity throughout the day or the week. Ideally, building up to about 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity weekly. Again, if that sounds unreasonable or if you have concerns about safety, connect with your oncology care team and then ask for a referral to a rehab special or vital cancer rehab specialist. Perform strength training at least 2 to 3 times a week, working all major muscle groups, and begin each workout with a warm-up and end with a cool down and stretching. Again, connect with a vital cancer rehab specialist near you if this seems daunting or you don't know where to start, or you want to make sure that you're feeling safe and confident while you do this. All right, to do or not to do, that is the question. So I started out asking you all to visualize and imagine how you want to feel this holiday season. And I know that in an ideal world, cancer would not be a factor in that task, and all of this making you map out your activities, change your plans, or pass on normal traditions. But even if cancer was not part of the conversation, I would still encourage all of you to think strongly about what you do and don't do to celebrate a holiday. Feeling compelled or pressured to host a big family dinner, to travel long distances, or put up every piece of celebratory decoration doesn't make a holiday special. That only comes from using this time to reflect on the real reasons of why we are celebrating. Ultimately, you know what is best, what is realistic, and what is meaningful for you and your family. You have options. You could do it all, do none of it. You could do a couple big things or more smaller things. Whatever makes sense for you and brings you joy is what you should be doing this holiday season, regardless of what stage of the cancer journey you're in, or even if people aren't diagnosed with cancer at all. So today I share the importance of time and energy management and what that can look like during the holidays or special events. Again, I encourage you all to keep sight of what really matters by trying out some of the tips and tricks that I mentioned. Emphasis on time management and energy conservation and all those kinds of little activities that we do this holiday season. So there are so many ways to keep that image alive and stay mindful of this holiday season and keep feelings of stress, worry, and loneliness under control. Always remember to reach out to your oncology team or a vital therapist if you need more help. But there's also a ton of great resources out there on mindfulness. This is such a great way to stay in touch with yourself throughout any time of the year. So here's some great active and passive ways to bring mindfulness into your holiday routine that will be available actually in a handout after the session. applications on your phone, Calm app, even Apple and Fitbit health tracker apps have some mindfulness meditations or breathing exercises you could do on your phone or watch. YouTube has endless and free opportunities for meditations, stretching, and breathing activities you can try. Some search terms you might want to use to get you started could be mindfulness, guided visualization, soundscapes, or ambient noise. Another opportunity to bring mindfulness into our day is to pick a word of the day and meditate on that word's presence in your life or what you could do to try and cultivate more of it. Try thinking of words like gratitude, joy, peace, humor. As Elsa once said, let it go. Proactive, warmth, love. All great ways to cultivate more of those things in our lives. Deep breathing or diaphragmatic breathing are also really great ways to reduce stress and improve our mindfulness of how we're feeling in that moment. Real quick though, if you'll all indulge me as we wrap up here, we're going to do one of my absolute favorite quick mindfulness exercises together right now. All right, so everyone get comfortable. You can sit down, lay down, or a little combination of both. And let's start with a really big, deep cleansing breath. Thinking about filling your belly with air, pulling air down into your lungs. Seeing your belly rise as you breathe in and go down as you breathe out. Now, we're going to count down to calm. I want you to look around for 5 things you see. Feel free to say them out loud or think them quietly to yourself. 5 items or things you can see right now. Now, closing your eyes, I want you to identify 4 things you hear. Tune in to all the little background noises. Can you hear the heater or air conditioning running? Can you hear car traffic outside? Can you hear my voice? Now, I want you to wiggle your fingers and toes and feel around for 3 things or textures you can touch. Are they soft? Are they fuzzy? Are they cold or warm? Now, with your eyes opened or closed, identify or find 2 things you can smell. Do they smell good or bad? Do they smell like flowers or warm apple cider? Or something else you would love to be cooking? Lastly, I want you to take a big bite or drink of a snack if you brought one with you today. If you didn't, think of something that would taste absolutely wonderful right about now. Think about what that feels like, tastes like. Is it warm? Is it soft? Is it chewy? Is it cold? When you're ready, take another big, deep breath and open your eyes if you haven't yet. So I encourage all of you to use this quick activity immediately in a moment to calm racing thoughts, or you could even plan a whole evening around creating an environment that makes you feel grounded, mindful, and present, filling your environment with all the things that you like to see, hear, touch, smell, and taste. Thank you again for your time today. I hope you're feeling present and ready to get into a holiday spirit with some new ideas on how to navigate these occasions. You can find more information on our program at revitalcancerrehab.com. And I want to wish you all well and hope to help you live well beyond cancer. Thank you.
Thank you, Jessica. I actually already feel calmer. It was a really lovely way to end the workday. And we've already got some questions rolling in, so we're just going to go straight into them. The first question I have is, if I don't want to rely on my phone for alarms, what else could I use?
Yeah, so especially if you don't want all the notifications, because especially if you're using alarms or kind of auditory signals like that, your phone will beep a lot at you.
Mhm.
So the other thing too is your phone can be right by you, so you can just kind of turn it off, right? Who hasn't turned their alarm off? Just like, meh, I'll
Right.
snooze later, right?
Right.
So one thing you could do too, even if setting like just the oven timer. So in that way, if you're in your living room doing something, you actually have to get up and go and turn that off. So especially if you're trying to end what you're doing, right? So
As
if
a
you're going to set,
reset. Yeah.
exactly. So if you're going to cap it, I'm going to wrap presents for 40 minutes, and then I have to be done.
Mhm.
Then that way it ends. It puts a wrap up on that whole activity.
Yeah, I love that. And if you're just thinking about, planning and time management, sometimes at the start of a day, I just sort of plot out how I think I'm going to spend my time. And I often tell my patients that too. Instead of just rushing into your day headlong and always sort of reacting and catching up and things like that, take that 2 minutes with your cup of tea or coffee in the morning or your oatmeal, whatever it is that gets you going, and just sort of, like you did with us, think about what you want your day to look like, right? And sometimes that can really help with time management as well.
You bet.
Yeah. Okay. With COVID, aren't things very different, especially with socializing?
Certainly.
Very different.
So, yeah. So, I mean, even socializing too via Zoom, like what we're doing tonight, there's a lot of, I think the advent of this too, with making online games or kind of funny little tips and tricks of ways that you can interact via Zoom, or I've heard of people, if people feel comfortable walking, they can go outside and take a walk at socially distanced ranges and things like that too. So yeah, and I think again, socializing during a pandemic is so unique too, let alone during the holidays. So I think there's just a lot of creative ways to get together, and while still, making up for distances or COVID protocols too.
Yeah. And honestly, I mean, if you had told me 2 years ago that you could actually have a connection via Zoom, I might not have believed you. But I have had everything from, meetings, which we do, and things like this, to catching up with girlfriends and having a cup of tea or a glass of wine, to playing a game, like an online game. And you can do that safely and virtually. And you can even use silly filters if you know how to use your computer, right?
I mean, there's even theater companies that are doing whole theater productions via Zoom.
Yes.
People have gotten so creative with this.
Correct. Like murder mysteries and things, right?
Yes.
Yeah. Next question is in. I have family depending on me. How do I tell family members I can't do everything?
If a family member told you they couldn't do that, how would you respond to them? Right. And then it's okay to expect that response from other people too. Especially if we're thinking about the long game, right? I don't want people to be so fatigued or so overwhelmed by the holidays, because everyone can get overwhelmed by the holidays. Mm-hmm. And there's a lot of power in just saying, no, not this year, or can we reschedule that? Mm-hmm. And giving yourself the ample time that you need. And again, I think that's even important when we're not going through cancer treatments. That's just a matter of taking care of ourselves too.
Agreed. And honestly, I think I had this conversation frequently with patients. Usually when we really dig into it, it's honestly more the person is more concerned than their family. So I'm like, here's what you say: I can't do everything. Right?
Yep. People usually feel more distressed at the idea of telling their family than their family is actually in because they're your family. They love you. They don't want to force you to do anything you can't do.
Right. So, yeah. When I've revisited that with people and I say, how did that go for you? They're like, oh, great. They're like, don't do everything. I'll do it.
Yeah. Yep.
Right.
Give somebody else an opportunity to step up and try something different for that year.
Right. Next question has come in, and it's, I'm a 30-year survivor. Congratulations. With a lot of health issues related to high dose radiation to the neck. How can I stick to my exercises? I went for PT and speech language cancer rehab. Thank you for these lifelong reminders. I live with fatigue, and this is very helpful. So how can I stick to exercises, Jessika?
I mean, I think I need to take a note out of my own book on this one.
Right.
I mean, yeah, yikes. So I would just say humans are so programmed for routine, right? And I think if we even look at kids, they're always a good reminder of biologically what humans are kind of innately programmed to do. So in terms of sticking to your exercises, this is what I said about creating a schedule, right? And just setting
Right.
those things and saying, you know what, I need this time to do this, and not undershooting it and giving yourself that time. Because I am, if I'm supposed to do stretches every day before bed, which I am, right? To manage some hip stuff, right? If I stay up just 10 minutes later to do my stretches, I sleep better, right? I have better quality sleep and I feel more well rested if I just rush and ditch my exercises, right? So I would just say keep that, like, don't cut corners and other things, and just set that as a priority for you, right? Because you can't give more if you have nothing else to give. And this is you investing in yourself. Making time for that exercise improves. I mean, I go back to that slide. It improves your energy, it boosts your mood, and it makes you that much more of a ready participant to engage with your family and give back to other people too. So you have to give to yourself if you're going to give to others.
Yeah, great advice. And one other thing I say to people that, it goes back to the 4 Ps and thinking about, maybe the day, if you're in active treatment, the day after that is not the time to think you're going to start that. I'm hitting the gym hard. But, give yourself grace on those days you don't feel great. And maybe that's a 5 or a 10-minute walk. I find just even getting outside and walking for 5 minutes, that's a great reset as well, right?
Yeah. And I mean, so again, I like to be active. I like to dance and be active and goofy like that. So even going on YouTube, there's a bunch of chair Zumba or chair yoga too. So if you don't feel steady on your feet, that's another really great way to at least get some movement. Think about breathing and some simple stretches that aren't going to be overly strenuous, but break up the monotony of sitting on your chair or on your couch, or even a long car ride, whatever you got going for your holidays.
Right.
Doing little things like that where, again, you're giving yourself energy back rather than exerting more.
Agreed. Completely agreed. And again, yes, YouTube has it all. Like there is, if there's something you think I would like to work on my breathing or do some new yoga stretches, you can Google about anything now.
Yes. And even I'll throw one more in there. If you like Zumba, if you like dancing, if you need something to feel energized too, right? So in terms of a sensory processing, sensory regulation, calming music, low key, very predictable beat patterns, right? That's going to down regulate our sensory system, give us that sense of calm. But if you want to be kind of up and excited, I do recommend a little bit of Zumba. And if you pick a song that's right. So one of my favorites, I love ABBA. So, right. So, okay. So Waterloo is actually a really fun chair Zumba routine that I love doing with patients when they don't feel super confident on their feet yet. It's really fun.
And it really is a great, how can you not have your mood lifted listening to ABBA? How can you not? Here's our next question. Speaking of weird times with COVID, it is spiking in my area. Is there a way for a therapist to come to my home?
Yeah, so not necessarily to your home, at least through the Revital team, but we do have tele-rehab as an option, right? So we can even do initial evaluations depending on patient safety, right? Depending on what skills you want to work on. We get to collaborate with you in terms of kind of deciding what area or what place would be best for your care. But especially following up with home exercises, I use tele-rehab a lot in terms of if someone wants to say, you know what, I don't want to come into the clinic. Fantastic. Let's work on some of your exercises via tele-rehab. Let's tweak them a little bit. So that way we can reduce your exposure there too.
Agreed. And regards that is just at the end, we'll let you all know how to find a Revital cancer rehab therapist where you are. And that is going to be state dependent on the tele-rehab. I think what is good to know, because again, who would have known, it's as simple as literally clicking on a link to be able to do tele-rehab, right, Jessika?
Right. Yeah.
Yeah. Sometimes I've had a couple of older patients or not so tech savvy, a little concerned about it. And then when we went through how to do it, they were really amazed at how easy it was, but also how they could really benefit and have a really good session from the comfort of their own home.
Yeah.
Next question. Can you talk more about what I can say in the summary speech you talked about? I don't want people to know too much about my diagnosis.
Certainly. Well, so again, you can just say, I was diagnosed with cancer and I'm kind of figuring out a treatment plan right now. Even if you know exactly what the treatment plan is, you can just say, we're kind of at the drawing board.
Right.
Tell me about you.
Right. That's always a good one. You can and deflect. Right. Back to them. And I would agree with that. You can tell as little or as much as you feel comfortable with. And I think it was a great advice to think about it before you go into those social situations. Because I think sometimes people just sort of, it catches them. And then they're like, well, they end up telling their whole story and everyone has advice. So really think about what it is you want to share with people. And again, I promise you, if you say to people, I was diagnosed with cancer and I'm figuring it out, people will respect that. Mm-hmm. People won't keep pushing. I'm a caregiver for my mum. How can I get her to let me help her during the holidays? Good luck.
Yeah. Depends on how stubborn she is. No. So if you're the one feeling fatigued and you want to try and pass that off to someone else, right? Or encourage someone to invite someone into that to save yourself, instead of making it feel like, yeah, you're taking something away from your mom's role. Like if she is always the one that makes the deviled eggs, I don't know, right? That's her thing, right? That's her role. That's her habit. That's what she does when you all get together as a family, right? Or that's what she drops care packages with. Right. So I don't want to take away that role. If anything, say, Mom, how can I support you to do this? Can I do the grocery shopping for you? Can we do this together? I've never seen you make the deviled eggs. Or is there a specific way that you do something different that I can implement myself? Right. So instead of saying, I'm going to help you, you can say, can I see how you do this? How can I help? Because I'm generally interested.
Right. So, and I completely agree, because it's a great opportunity to spend time together to learn their skill. But another thing that I love is you can just do the hard parts of it. The shopping, get everything out, put it on the counter. You can cook all the eggs, peel the eggs. Everything can be broken down to as much or as little as someone really has the energy for.
Right.
Okay, next one. A comment that may help others. I talked to my doctor and we were moving around some of my appointments so I can feel good for our family gatherings.
Really good.
A great idea. And this is very much going to be driven by your care team, by your medical care team, but you absolutely can speak to them and see if you're in active treatment again, is there any way to move it around for that important lunch or whatever it is you want to do with your family? And they'll be upfront whether that's an option for you or not. But I think that's a great idea.
Yeah, I think another one too, an easy way to kind of deflect is if someone, I'm thinking like so if another survivor comes up to you and says, oh my gosh, like, are you on this treatment too? Another easy way to say it is, oh gosh, I don't even know what I'm taking, right? I can't pronounce it.
Right.
And then it's up to them to kind of stop digging at that point too, right? So find an easy avenue. If you're not comfortable sharing that, right, then find an easy avenue out and ask them, I can't even pronounce mine. What are you on? Or again, if you don't even want to just get off the whole topic of treatment as a whole, because life exists outside of treatment too, and you can talk about those things.
Correct. And I think another way you could pivot there is you can easily say what your start of, honestly, I don't even know the name of my medication, or I can't pronounce it, or, but then you can also just quickly pivot and say, hey, I haven't been out to be able to enjoy family or friends in some time. And I just really want to focus on what's new with you. Or, I really don't want to talk about that right now, because that works too, right?
It does.
Yeah. If I'm tired all the time, how do I even start thinking about how to conserve energy or exercise?
First off, I would encourage you to think of it as an opportunity, right? Conserving your energy or starting a path of making a schedule isn't another to-do item. It's an opportunity, right? This is you taking charge of what you've got, and allotting the time it needs for whatever you need, right?
Right.
So I would say one of my favorite things to do, and I do this a lot, is I call it a brain dump list. I write down everything that's on my brain, either a to-do list, something that just keeps like something I don't want to forget, something that I want to do, and I just put it all down. And then I'm able to go back and say, all right, what do I want to do first? So that prioritization piece, and you have to take it in chunks. You're not going to be a master of it the first time, right? Set, and like what Kirsty was saying, set a goal for just your day first, and then go for that. Or give yourself a few weeks to plan for, oh goodness, I don't know, 4th of July, right? So thinking about something ahead of time to say, all right, I'm going to plan my meal today. I'm going to make my Costco run another day, right? And so starting to even just break it apart so it doesn't seem like such a daunting task, right? And then by seeing it all out, it's almost like working with a puzzle. You can't put a puzzle together if you don't even see all the pieces or if you don't have a diagram. You got to be able to see all your pieces, and then you can put them together in a way that's meaningful and effective for you.
Yeah. Love that one. And sometimes I do a similar thing. Of course, I'm not as creative and don't call it a brain dump, but I write down the 3 things that have to get done, the 2 things I would like to do, and then the 1 optional thing. So I just sort of prioritize, and I give myself that permission at the start of the day or as I'm going through my day. And if I'm getting a lot done, then I can get to some of those optional tasks. But if it's, all of us get tired, all of us have things come up. And if it's that day, I just say that moves to tomorrow's list. Right.
Yep. And then I keep a little list by my bed too. So if it's something that I wake up in the middle of the night, or if I can't go to bed, I'm really restless, I'll put it down there and say, you know what? I can't forget it. It's written down, and I will address it when the time comes. But right now, I need to sleep, because otherwise I won't be able to get anything else done tomorrow.
And I think that is such great advice to end our Q&A for today. Thank you, Jessika. I really think it was helpful information and a great reminder, whether you're dealing with cancer and its treatments or not, just for all of us, that this is a very busy time of year. And you've got to look after yourself first, correct?
Yeah.
Yeah. Well, thank you for joining us. And I'm going to finish up by letting everybody know that this is our final Living Well Beyond Cancer for 2021. Another COVID year in the books. Keep an eye out for your email in the coming week, and you will get a handout from Jessika, as well as some information about what the series will look like next year. You can also go to our website, revitalcancerrehab.com, and that's 2 R's for the cancer and then rehab. And it has all of our past presentations, as well as how to find a therapist in your area and other information on our website. If you're not internet savvy, you can call 844-473-8485. And you'll be able to leave a message to speak with a Revital therapist directly to find out if cancer rehab is right for you. Please be sure to follow us on social media to stay up to date on new information, inspirational stories, resources, and next year's series. We hope you found today's topic valuable, and we really wish you all a wonderful holiday season and a healthy 2022. Thank you.